Developed by UCLA, Longvida Optimized Curcumin is one of the only supplement ingredients known to impact most of the main targets responsible for cognitive function during normal aging. Supported by several rigorous human pharmacokinetic and placebo-controlled clinical trials, Longvida is the optimized curcumin of choice for researchers and physicians around the globe.
One of the big issues whenever you're talking about any curcumin product is how much actually gets in and does something. In this case, giving the Longvida, again, at not really high doses, we got a variety of effects. So obviously, a good amount of active ingredient is getting into the bloodstream. And seemingly, the way the Longvida is prepared, which is quite different than most curcumin products, that seems to give a very active product that has effects. The results we got for the Longvida seem to affect some different aspects of health that could be relevant to the brain. Some products only affect one thing or another, but we saw a number of different effects. For example, we saw a number of different improvements in markers for antioxidant function. So that can protect the brain because the brain's vulnerable to oxidant damage. We also saw a decrease in a protein in the serum that's called VEGF. This protein is a marker of a buildup of blood vessels, but not in a good way, in a way that could lead to problems in the brain like premature senility. And we saw a decrease in that protein. So that was a positive effect. And we also saw a decrease in beta amyloid levels, which is a marker of a different kind of brain health concern. So I think what was interesting about this study in terms of brain health is we saw a number of different effects, not just one thing. We saw the antioxidant effects, we saw the effects on this VEGF protein, and we saw a modest reduction in the beta amyloid levels. Yeah, if a healthy person was to take the kind of dose of Longvida that we used in this study, about 80 milligrams of curcumin a day, a very modest dose, we think that you could see some effects on health promotion that are actually pretty substantial.
That you have something which can engage the target. You know, it can get into the brain, it can get into the retina, and then bind. And if it's glucuronidated, it won't bind. I mean, its binding is based on its spacing, how it fits in with the amyloid. So it's and the hydroxyl groups that get glucuronidated are targets. So you have to have the free. So it's an index of the free drug levels getting in there and engaging. And of course, when you see that in the brain, in a week the plaques are shrinking and disappearing. So you're getting a nice response.